Welcome back to Desk Careers. I am so excited to bring another incredible guest. Today we are speaking with Nidhi Kotak, the Chief Resident Pediatric Dentist from Temple University, who is also a certified lactation counselor. You heard me. We're going to be talking about not only her career as a dentist, but where in that equation did she become a certified lactation counselor? Welcome, Nidhi. It's so exciting to have you here.
Hi, Maria. Thank you for having me. I am so pumped to be on this. Well, it's tonight for me and it's morning for you.
I'm so excited that you're zooming in, giving us this time. What time is it in Philadelphia right now?
Almost midnight, guys. Almost midnight. So
that is dedication. I really, really appreciate it. So anybody watching this right now, we really need to appreciate that Nidhi has gotten on her Zoom call to talk with us at midnight in her time. Nidhi, without further ado, I want to take you backwards in time. I really enjoy asking my guests to take us down memory lane when they were younger, because I think sometimes young people look up to role models such as yourself, and they almost expect that they went from where they are today to the potential career where you are in that moment. So by taking us backwards, it helps a student see the journey and resonate with the process that they're going through right now, and look forward to some of the milestones that you'll be talking about. Can you remember being about 15 or 16?
I can, and I will tell you that I never ever anticipated that I'd be where I'm at today. In fact, if you asked me 3 years ago, I didn't know that I was going to be living in Philadelphia at this time. So I do believe in planning. I'm a massive planner, but I do think that also, life has a certain role to play and you got to kind of play along. So when I was 15, I was born and raised in India. I was in school until the age of 16 in India. And then I moved to Dubai for high school. That's where my journey in Dubai started. I moved back to India for dental school. That was about 5 years in South India in a city called Manipal. Graduated as a dentist in 2011. And I decided that I wanted to broaden my horizons. I took an exchange program at University of Southern California. Decided to move to the United States and did a foreign trained dentist program at University of Colorado, and I got a license to practice in the United States. And then I practiced between Dubai, Chicago, and a little bit in Kenya for about 5 to 6 years, and now I've moved back here. So I'm in Philadelphia right now, and I'm in a residency program. I'm one of the chief residents at a pediatric dentistry program in Philadelphia.
So I think one of the things I want to celebrate right now is how you were going with the flow of not just your education, but also moving from one country to another. And I think sometimes young people overlook the challenges that one faces when you are moving around. It's not just about your education. What kind of a cultural education did you gain on this journey that makes you who you are today in your profession?
So I think on a professional level, dentistry per se doesn't change so much. I mean, people have tooth pain, they go to a dentist, but I think the perception that patients have changes, and culture plays a huge role in that. So for example, when I was practicing in Dubai, aesthetic dentistry was a huge part of whether it was my job interviews or whether it's what my patients asked for. So it was a lot of whitening and aesthetics and veneers. When I went and practiced in Masai Mara, where my clinic was run on a generator, we didn't even have electricity. It was a whole different ballgame where I was working in the middle of the African savannah, and I literally woke up in the morning and heard a lion in the distance and saw a giraffe. So that was very different dentistry, where we just wanted to get people out of pain. So it was a lot of bread and butter dentistry. In the United States, it's a lot of preventative care. So it's all about coming in early, getting your regular checkups and cleanings and x-rays so that we can detect things early to prevent you from having dental pain and extensive dental work in the future. So I think that culture does play a role in just patient perception of dentistry as well. And from a struggle that I faced, just, on a personal / professional level, every country that I practice in, I need to get a separate dental license, a set of licensing exams. So that was probably one of the hardest things to do. And while I was practicing in Dubai for the last couple of years, yes, we did have, COVID-19, the pandemic that hit our clinics. All along, I knew I wanted to specialize. So right now I'm here in Philly, but my family and my husband, everybody's in Dubai. So it does involve a lot of struggle, but when you have a goal that you set for yourself, as long as you know what you want in life and you have people around you that support you in achieving your dream, I think that it's very possible to make it happen.
Absolutely inspiring. I've been following you on Instagram. I have to say, I find your approach to, I believe that you're educating your followers on your social channel. And also, I feel like you're changing the vibe of dentistry. I know that you work with children and pediatrics. Talk to us about how you're using your social channel and why you've decided to use that approach in your profession. Because I think young people don't realize a lot of what we do is about perception, which you mentioned in talking about that different cultural perception.
So I think that, for example, for me growing up, I only went to the dentist, or I was only taken to a dentist by my parents when I had pain. That was just what was the norm growing up in India. I think even today in Dubai, for example, while we're trying to spread the message, it's not very common to go to the dentist every 6 months, for your regular checkups. And I think that's the thought process we want to bring to the world. That's how things work here in the United States. And I tried a lot when I was working in Dubai to do, talks with, children in schools, with pregnant mom associations, where it's so vital to understand the importance of oral health care for a child. Bringing in your child to the dentist at the age of 1 and every 6 months after, because if you're bringing in your child, or even as an adult, when you're going to the dentist in pain, you're going to associate that with a negative emotion. It's a lot harder for you to have a good experience because you're having crazy throbbing pain. And by the way, dental pain, they say, can be worse than labor pain. I can't relate because I've had neither, but from all my patients that I've heard, this is the general story that I get. So rather than you coming in when you're having that intensity of pain, if you come in for your regular dental checkups, it's much easier on you, and of course, much easier on your dental provider. And it's a lot more cost effective as well. A lot of the times people associate dentistry with high cost, and they want to avoid going into the dentist because, a lot of people don't have dental insurance, and I understand that. But what I always try to educate my patients with, is saying that if you're coming in for your regular dental checkup, cleanings, you're avoiding having that crazy appointment with the root canal and the crowns and the implants, because those are the very expensive procedures as adults. And similarly with me on my social media, I'm just trying to reach out to young parents. I feel like awareness is so important. And, my parents are physicians themselves. And in that day and age, 30 years ago, it wasn't very common to bring your child to the dentist. And I feel like a lot of the times I'm seeing kids at the age of 2 and 3 where parents have already kind of, missed that memo to bring in their child for their first dental appointment at the age of 1. So it's kind of heartbreaking when I see kids at the age of 2 and 3 with a mouthful of cavities. At that age, they can't cooperate to sit still in a dental chair to have treatment done, which is why we have to sedate them. We have to put them under general anesthesia to get work done. So rather than go to that stage, I want to try and work with parents at a much earlier stage to educate them and say, hey, why don't you come in early? Let me talk to you about what causes cavities and how you can avoid them, or how you can avoid them from getting addicted to a pacifier or thumb sucking, so we can avoid all the problems later on and just ensure that your child and you as a parent have a smooth experience going into that dental journey.
Amazing. I want to just take a moment again here and talk to our audience right now. The stories that you're sharing about how you're educating as well as you're working in practice. How do you believe this can help a young person who is applying to medical school when in particular they either have to write a letter explaining why they want to join the medical practice, or if they have to sit an interview and they're asked the question? How does what you're telling us give them a little insight into how they can answer those questions?
Um, so prior to COVID-19, I think pre-dental or pre-medical students had the opportunity in various countries to go and shadow or observe healthcare professionals, in their field. This gave them a good idea of, what a day in the life of a dentist or a day in the life of a cardiologist looks like. So they know what they're getting into. It also helped them to, understand the vibe of a hospital, what it takes to be at the receiving end of very stressed out patients, how to deal with that. And, from an application standpoint, when you write on your application that you have been done an externship or an observership with a dentist or a doctor or whatever it is, that really helps. Now with COVID-19, at least here in the United States, it's been very limited for pre-dental or pre-medical students to have those opportunities. So which is why they've been doing a lot of these things online. So that's something that I've been doing a lot over the past year, is hosting a lot of, these online webinars or just pre-dental meetings where I talk about what my day looks like. What are the kind of cases I do in my daily practice? I show them pictures. I think it's very important for somebody going into this profession to truly understand what it takes. It can be almost the idea of healthcare, or sometimes people look at the numbers. Oh, this is how much you're going to be making as a healthcare professional. But I always tell pre-dental students, it's very important to know why you're getting into this. You need to be passionate about this, passionate about helping people. And, yes, the finances, it all adds up, but that is all secondary. If you're not in it for the right reasons, I feel like you can burn out pretty easily, which is why I think it's important to, I think it's really nice to be able to have the opportunity to inspire young, college students to get into the idea of this field, and make sure they're getting into it for the right reason. So that's kind of where I come in, and I love talking to college students about it.
Amazing. All right, Nidhi, what does it take to be a dentist? What are the skills, the character traits that one needs to develop in order to do what you do and enjoy the process?
So this is actually interesting. From a technical standpoint, your hand skills are very important. For instance, I always tell people that, if you're really good with arts and crafts and with, stitching and things like that, those are, science. Even things like, somebody who does really great manicures, the little technical details that you can look into, I think that plays a good role into knowing whether that's something you'd be into. But for a patient really doesn't know what it takes to be a dentist, right? And I feel like your people skills is 90% of your profession, because I feel like it seems to be a common ideology where patients do not trust the treatment plan provided by their healthcare provider or by their dentist, which is why I oftentimes have so many of my friends reach out to me saying, hey, these are my x-rays, I'm in so-and-so country, and this is what my dentist recommended. Can you tell me if you agree with this treatment plan? So I think that your ability to gain trust of your patient, to have the people skills, and I always tell my patient, and I genuinely mean it, when I was working as a general dentist, and if I had an older adult, what I would say is, hey, if this was my mother, this is what I would like to offer to my mother as a patient. Or if this was, and now I say, if this was my child, yes, you have option A, B, and C. But if this was my child, this is what I would pick. And, I truly, genuinely believe that. And of course, there are facts. Finances play a huge role in what will help decide a patient take the treatment plan that they, will eventually decide on. But I think the fact when a patient can trust you, I think that's a huge role in what it takes to be somebody who patients will come to. And I think that, marketing plays a good role online and all of that, but it's word of mouth. That's the most important way of, having patients come back to you, because if you change one person's life and you get them out of pain, or they can trust you and they know that, hey, my smile is so much better, that's when you're going to get the rest of the patients come to you. So sure, marketing is important, but I think it's when you build that relationship with your patients, and of course, skills is so important, but I think that comes with dental school. You'll gain that. And it's your ability to form treatment plans, talk to the patients, and make sure that you have that relationship that really plays an important role as well.
Amazing. High school students or secondary students are almost at the liberty of the gatekeepers, and those gatekeepers define and decide that your grade should allow you passageway to medical school. Now that you're doing what you do, is it as important as they made it out to be at the beginning of secondary school, that your grade at a secondary level should determine whether you can or cannot go on to medical school? Or now that you're doing this, do you see that actually emotional intelligence and the ability to gain trust are things that are really vital and things that are character traits, and we can train the other skills?
If you asked 15-year-old Nidhi, I think my answer would be very different. I think that we were all trained to believe that grades are everything, and that's not me undermining the importance of grades. I do think that grades are important to apply, to get into school, even to get into residency. My GPA from dental school was important. So yes, absolutely, grades are important, but I don't think it's everything. When you get to the stage of interviewing, it's your personality. There's so much more to it than just grades. And right, you said your emotional intelligence, all of that plays a very important role. I think that for, students at that stage of life, of course, working hard, getting grades is important, but I think it's also important to branch out a little if you get the opportunity to do, especially if you're interested in healthcare, trying to shadow anyone in that field that you get an opportunity to do, volunteer in any way you possibly can. Obviously at this stage, you're not going to be able to volunteer to be a healthcare professional. But when I was at your stage, I remember I was in San Francisco, and there was this project called Project Homeless Connect, where I was literally just writing down the names of all the potential patients, which were the homeless people of San Francisco that came in, checking things like blood pressure with an electronic blood pressure cuff and things like that. So any way that you can, introduce or inject yourself into the field to show you're passionate about it, B, show that you have what it takes to really get through it. And of course, your grades. I think all of that builds to that final stage of your applications and getting into school. So I think it's a whole spectrum of things that plays a role into you eventually getting to that stage of getting into medical or dental school.
Let's go back to your medical journey, that pathway that you took to medical school. What was that like for you on that academic journey? So you studied in India, you went to medical school in India, and then you moved abroad and did a few different things. You said you had to recertify in the different countries that you worked in. What does that mean for a young person applying to medical school? Is where they go to medical school very important, or will it just be about upskilling as you had to do every time you moved?
Unfortunately, the answer is yes. I do think it's important where you go to medical school, because I think not every country is going to accept your medical degree. So for example, in the United States or in Canada and North America, they only accept each other's medical or dental degrees. So if you are a foreign trained healthcare professional, in my case, a foreign trained dentist, you have to go through a 2-year program to convert your foreign dental degree into an American degree. I found this program that I did in Colorado very, very beneficial to improve my skills and really get to the level where I felt comfortable treating patients in a different country, in a different cultural settings. Now that's only for North America. To practice in Dubai or Kenya, I didn't have to go through training again. I had to take licensing exams. But I think in general, I think it's important to know where you see yourself settling in life, because you don't want to have to recertify and retrain based on the country you're in. So it does help to have a slightly long-term vision. Having said that, I had none, and it's not impossible. So I have done it a couple of times, and I would probably do it all over again in the same order, because I think that I've grown so much as an individual, so much as a healthcare professional. I've learned so much, about myself and about the profession by treating patients in completely different geographies. But it does help to have an end goal of where you want to practice, because I do think that will help with your licensing process a lot.
I completely agree. I think that is one level up to a young person, not just thinking about the occupation, but also thinking about the lifestyle that they want to be having, doing that occupation as well. Okay, you talked about being a general dentist, and now you're a pediatric, but you're also the chief resident. Can you talk us through what those things mean and what a young person should be aware of when they're thinking about the career pathway?
Okay, so once you graduate from dental school, you are a general dentist, and you absolutely can practice as a general dentist. You can practice all fields of dentistry. And whenever there is a difficult case, that's when you refer out to the specialist. So for example, as a general dentist, if I had a very anxious child, I would refer them to a pediatric dentist. If I had a really challenging root canal or a really challenging impacted wisdom tooth, which I didn't want to touch as a general dentist, or I didn't have enough training for, I would refer them to a specialist. As a general dentist, you can work on adults, you can work on children, and you can do really well for yourself. However, if you know that there is a particular part of general dentistry that you truly enjoy, whether it's working on kids, whether it's doing root canals, whether it's doing bridges, you can super specialize, which is what I decided to do. So it's a 2-year training program. We specialize in pediatric and special needs. So usually we see children up to the age of 17 in my current practice right now, and anyone with special healthcare needs. And to me, I had been in many practices as a general dentist that saw pediatric populations. And I, at some point, started feeling really frustrated because I felt like I was the middleman for a lot of cases, where my heart ached because I wasn't able to provide the level of dentistry that the child needed, because I didn't have the skill set required to, treat an anxious child. Things like sedating a child, working with an anesthesiologist to treat the child under general anesthesia, being able to handle children with autism on the spectrum. So that's when I realized, hey, I'm kind of good at it. I want to get really good at it. And this is it. This is what makes me happy. And that's when I decided to go back and specialize. And it's a 2-year program. In my first year, we were doing a lot of, we deal with, infants as young as 3 days who might have a tongue tie. We do use a laser to do something called a frenectomy, which is basically getting that tongue tie treated in a young child, which is why I decided to also become a lactation counselor on the side. All along, we have a team of 10 residents each year, so a team of 20 over the 2 years, and I was elected as one of the chief residents. I feel like, I've always been kind of enthusiastic. I'm very protective of my class. And I feel like we work really well together as a team. So I think that played a role in them electing me as a chief resident. And I'm just happy as to where I've come so far in life, and I'm continuing to grow every day. I feel like every day I see a new case and I'm like, wow, I've learned so much today. I've grown so much today. And, given that I've been in the dental profession for a very long time now, and I'm continuing to feel like, wow, I'm just at the beginning, at the tip of the iceberg. So I feel like never get content with where you are. There's just so much more to keep growing and learning. And that's the attitude everyone should have, whether they're in their 40s or 50s or as I am in my 30s. That's the attitude that I feel like really helps you to become the best version of yourself and the best healthcare professional for your patients.
Very inspiring, Nidhi. Okay, let's go back. You kind of took us very quickly through how you became, or why you became, a certified lactation counselor. How does that help you right now in your career with your patients? Is it that you want to do this, or is it just learning the awareness was what drove you to want to become certified?
So initially it was wanting to learn the awareness. I felt like I was dealing with new moms and I couldn't relate to them. I felt like it was very easy for me to give advice, but not to really know what they were going through. And I felt that at that point, I didn't know the right terminology to use, or the right way to address them, or to be sensitive to their, to their needs, to their, to the difficulties that they were going through. And, in the United States, the kind of cases we deal with are a little different from United Arab Emirates. So there was this one time where I had two moms come in, and I said, "Oh, which one's breastfeeding?" And they said, "Oh, both of us." And I just realized I couldn't understand what that meant. So I felt like for those reasons, I needed to go back and really educate myself to be able to know that, hey, I could be practicing in Dubai or India or the United States or Kenya, but I need to know the cultural differences that happen in a country so that I can best serve my patients. So it really helps me with the tongue ties and the lip ties in kids, and it really helps me relate to my patients. So my primary profession is still a pediatric dentist, but I'm also a certified lactation counselor on the side.
I love this. I love that you're showing the youth that you don't just do one thing, that it's about continuously growing and evolving, but also using knowledge and learning to better support your clients and your patients. I could keep asking you so many questions. I'm really conscious of our time difference. Just before we say goodbye, there's a young person watching this right now thinking, what will it take for me to become just like Dr. Kotak? What would you say are your top 3 tips to emulate not just the skill that you have, but the passion that you show us every day on your social channels, when we're meeting you as a doctor, or even when you're just talking to young people?
Okay, so I feel like it didn't happen overnight that I knew this is where I wanted to be. I feel like patience is important. I think it's okay to maybe choose a career path and then maybe have second thoughts and then go back a little bit and really truly understand what this is something that you're going to do for the rest of your life. So you want to make sure that you're in it for the right reasons and that you're happy. The number of people who are unhappy in their jobs shocks me. So I feel like it's okay if you want to start over again. So be patient, be perseverant. If you really want something, yes, it takes hard work. I never thought that in my 30s I would be in school again, but here I am. Most of my co-residents are a lot younger. They're straight out of dental school. I practiced for almost 6 years before coming back to specialize. So I feel like patience and perseverance, those 2 things will really help. And I'm at that stage where I'm, truly passionate. There was a time where I tried to do social media for dentistry as a general dentist, but I hated it because I didn't enjoy it. I felt like it wasn't organic. It didn't come to me naturally. But now that I feel like I've found my place. It's almost like, there's a skit and there's a play and that we're all playing our roles. And I finally found my role. It took a while. It didn't, like I said, didn't happen overnight, but now that I found it, I'm enjoying it. And residency is busy, but my spare time that I find, I'll try and engage on any online platforms. Like today, for example, when I had this opportunity to do something for young pre-dental or pre-medical students, I was like, you know what, it's midnight, it's fine. I'm going to be able to talk to so many people about it. So I think, patience, perseverance, and passion. I didn't realize they were all with peace, but those are really great things to help reach where I've reached today, what helped me.
Thank you so much. It's been such a pleasure talking with you. I really, really enjoyed our conversation. And I know that there's so much insight that you've offered our youth. I appreciate you. Thank you so much.
Of course. And if anybody wants to reach out to me, feel free to reach out to me anytime. I'm always available on my online profile, which I'm sure you'll be sharing. So reach out to me.
Thank you so much. And that brings us to the end of an incredible conversation. Today we spoke with Dr. Nidhi Kotak, who is a chief resident in pediatric dentistry over at Temple University, and she's a certified lactation counselor. Thank you everybody for watching, and we'll see you at our next Desk Careers Digital Spotlight.